Morning, everyone. I'm Wiedaad Slemming, and I'm from the Children's Institute just down the road across Rondebosch Common. So, as Riza said, you're familiar with the term soft-funded. So we are a soft-funded applied research unit at UCT, and we conduct interdisciplinary research. We're a team of social scientists, health professionals, lawyers, advocates, and collectively pool our capacity to address challenges facing children in South Africa, but also across the continent. And we do this because we envision a society in which all children are valued, nurtured, and protected, and where they can develop and thrive to realize their full potential. And we do this in various ways. So the core of our work is really in building an interdisciplinary research evidence base, using that evidence base for advocacy. We do a lot of knowledge translation to make that information accessible to decision makers. And we build strategic partnerships to really support and amplify all of our efforts. And we use all of this work in our education and training, and I'll show you some examples of how we do that. Our work centers across 6 thematic areas, the newest of which I've put in italics, which is really looking at how we secure better futures for children. So what's our impact story? And I think our impact story is best told in pictures. So I'll be showing you a few slides, just indicating some of our successes in recent years. And across each of these thematic areas, and I'll start with monitoring the advancement of children's rights. We've got a flagship publication, actually the next edition is due to come out at the end of August, called the South African Child Gauge. And this will be our 17th edition this year. The Child Gauge tracks progress for children around particular thematic areas. This year it will be on early childhood development, and it really tries to bridge the research and policy divide. It mobilizes the resources of UCT to make evidence accessible to decision makers and to support the efforts of civil society to hold government accountable. And we do this not only through the publication, but using the information in that publication in various platforms and fora to advocate for children's rights. The Child Gauge is a widely anticipated and used tool, and it gets a lot of media coverage. The last 4 editions of the Gauge generated more than 300 headlines, about 19 million rand in media coverage, 26,000 website views, and over 350 citations. We've also been nominated as a finalist in the Science Oscars. Last year, we were a finalist, and this year we've been nominated again. And this really just is an acknowledgement of the scientific contribution that the Child Gauge makes in society and for the university. It's notable that it was the only child-focused initiative in the science communication category, meaning that we need to be centering children much more in decision-making around policy, but also practice and in science. In addition, we also have an interactive online resource for data on children, which covers 40 indicators across 6 domains. You can see them on the left-hand side, called Children Count. And when you go onto the Children Count website, you can choose any of these indicators, and it will give you information related to that indicator example coverage, or what's happening for access to child support grants today for children in South Africa. It will tell you about trends in access or coverage, and it will also provide you with a summary of how to make sense of what the numbers tell us. So this is a widely used resource, not only for academics, for teaching, but also for policymakers and practitioners. We then take a subset of those indicators that focus on children under the age of 6, and indicators that are linked to an essential package for early childhood development, and provide a statistical review and analysis called the Early Childhood Review, which incidentally will be launched in July this year. So look out for it. We also use all of this information to do shadow reports to the United Nations, Committees on the Rights of the Child, and other committees, as well as to the African Union. And we do this in partnership with stakeholders within children's rights and practitioners working at the ground level, and really try and influence not only the concluding observations from these committees, but also to use these reports as advocacy tools for children at parliamentary committee levels and others. Our work on reducing poverty and inequality has shown that there's increasing poverty for children in South Africa, and that our primary poverty alleviation mechanism for children, the child support grant, is actually not meeting the needs. So what's happening is that there's a widening gap between the food poverty line and the child support grant, meaning that the CSG has lost its link to the cost of basic food and clothing for children. Our technical support to government has helped to grow the monthly CSG by 30 Rand in 2023, adding over 4.5 billion Rand to social assistance for children last year. Our legal advocacy has increased the number of children without birth certificates who access social grants from 30,000 in 2019 to 50,000 in 2023. Over the years, we've built a robust evidence base on the intersections of violence against women and violence against children, and our expertise has guided the constitutional court case that declared corporal punishment in the home as unconstitutional. We have a growing portfolio of work looking at enhancing the health and development of children. And one of the latest innovations that we are testing here in the Western Cape is introducing group antenatal care into the South African public health system. We've built a community partnership to strengthen safety, inclusion, and participation through our early childhood development research and an informal settlement here in the Western Cape down the road on the M3. And through that work, we've supported community partners to assist caregivers with resource materials, one of which shown here looks at how supporting caregivers to identify quality ECD centers for their children. Our work on promoting children's voice and agency supports them to be active citizens and to make sure that children are at the center of essential decision-making processes. In 2022, when the presidency convened a second gender-based violence summit, the CI staff successfully secured a pre-summit for child representatives as well as a children's commission in the main plenary, thus ensuring that children were included in the National Strategic Plan on Gender-Based Violence. Through our education and training, we are building a capacitated workforce for children, and we've developed over 250 child health advocates through our child rights training. We develop resource materials that are used widely by caregivers, by a range of health professionals and workers across different sectors in society. Two examples here are shown. One was briefs developed during COVID-19 to ensure that children's rights were protected in care. The other is a booklet that actually was adopted by SASSA, the Social Security Agency, and the Department of Home Affairs, where in collaboration we developed and adopted this booklet to support the access of children to social grants for those who don't have birth certificates. And on that note, I think I'll stop because my 5 minutes is probably over. But from the Children's Institute, I thank you, and this is our team, so not many of us, but we do try and have high impact. So thank you very much.